How do senescent cells cause inflammation in osteoarthritis? Imagine your joints as busy cities where cells work together to keep everything running smoothly. Over time, some of these cells stop working and become what we call senescent cells. These cells don't die off like they should. Instead, they stay in place, but they change how they behave. In osteoarthritis, these senescent cells gather in areas like cartilage, the lining of joints, and the bone just beneath the cartilage. Their presence is more than just a quiet buildup. It actually stirs up trouble by releasing special molecules known as the senescence-associated secretory phenotype, or SASP for short. These molecules include things like cytokines, chemokines, growth factors, and enzymes that break down tissue. When these are released, they create a local environment of inflammation inside the joint. The process starts when joint cells experience stress or damage from aging, injury, or oxidative stress. This stress pushes them into a state called senescence. Once in this state, the senescent cells begin to secrete SASP factors that attract immune cells to the area. These immune cells respond by releasing their own inflammatory signals, which amplifies the inflammation. This ongoing cycle of immune activation and inflammation causes tissue damage, like cartilage breakdown and swelling of the synovial tissue, which lines the joint. This damage leads to pain and stiffness, common symptoms of osteoarthritis. Specifically, molecules like tumor necrosis factor alpha and interleukins are secreted by senescent cells. These molecules stimulate immune responses that worsen cartilage damage and inflame the synovial tissue. As immune cells respond, they release more inflammatory molecules, creating a feedback loop that keeps the inflammation going. Additionally, senescent cells produce reactive oxygen species, or ROS, which are harmful molecules that cause oxidative stress. This oxidative stress further damages joint tissues and makes the inflammation worse. As more senescent cells gather and releases SASP factors, the balance between tissue repair and breakdown gets thrown off. This imbalance accelerates joint degeneration over time. Interestingly, scientists are exploring ways to remove these senescent cells or block their inflammatory secretions. Early research shows that doing so can reduce inflammation and pain in osteoarthritis. This means targeting senescent cells could become a new way to treat or slow down the disease. In summary, senescent cells cause inflammation in osteoarthritis by releasing molecules that activate immune responses, increase oxidative stress, and promote tissue damage. This ongoing inflammation is a key feature of osteoarthritis, and understanding it opens up new possibilities for treatments that focus on reducing these harmful cells or their signals.